let me say a good morning again to everyone, and wherever you are, where you're dialing in from, and thank the organizers, including ourselves, for putting all of this together. Mine is really a very short presentation to give you an overview of the accelerator. Let me just put it in presentation mode. Yeah, that's better. Now, most of you, let me just walk you back in time. And if you recall, early 2020 when COVID hit us, and we had lots of extraordinary challenges and uncertainties brought about by the pandemic for businesses, governments, and lots of stakeholders. This pandemic really showed us the dependency that Africa had on other continents, particularly on the issues of healthcare delivery. So with that, you would recall even as simple things as masks, let alone vaccines, were not available at the time. So we ideated with the support of JICA and of course the onboarding of our technical partners, BCG, and later on Villgro, how to bring about multiple homegrown innovative solutions to really bring about the resilience in that. And in late 2020, as I said, with the support of JICA, we started off the Homegrown Accelerator to support entrepreneurs and strengthen the continent's resilience. So in 2021 and onwards, we've really kind of taken off, and we've continued to really support this initiative so as to get to build that resilience, as I say, with our support of JICA and BCG and Villgro. So how did we go about? We had to be focused and intentional. Of course, it's not only a healthcare problem, but rather a complex one. But in ideating the Homegrown Solutions Accelerator, we really had to be focused on the health sector. We focused on priority solutions that look at the care capacity and increased use of digitalization. We had to be very intentional in the company stage that we work with, because of course, companies at different stages of growth have different and complex dynamics. So we targeted for-profit entities that had really evident traction and ability to scale. As the name says, it's a homegrown solution, so it's Africa focused. It's the solutions by Africa for Africa. But of course, we acknowledge the dynamic environment within that context. Our intention was to pilot. We did that in the East African footprint, and then we've now gone to a Pan-African state. We hope to continue having that sort of Pan-African footprint. As the presentation says, we really are one of the few large-scale healthcare-specific accelerators in Africa, and we distinguish ourselves by working with both growth as well as mature-stage companies. Quite a unique mix in that sense. As I alluded to earlier, we had to be intentional and focused. So these are our three offerings. We provide context-specific advisory, and BCG and Villgro have been really phenomenal in this regard with the technical expertise that they bring together. We look at investment readiness support, matching funding needs, preparing with coaching, reaching out, and then brokering some introductions where we feel that some potential deals could be struck. And last but not least, we match some of our cohort members to strategic partners that are identifying the right partners and how to unlock that partnership and also broker those introductions. What does from our pilot to our current 2022 Pan-African cohort, we really had, from the initial pilot, we had a application of 58 to the Pan-African state where we had about 160 applications that were received, a shortlisting of 28, and of course our steerco kind of zeroed in on 14 from whom you'll be hearing today. We really feel that we have this African footprint, and we hope to sustain this as we go forward in our steady state. So today, really, this was just an introduction, but the show is coming up next. So let me hand it back over to Elahe so that you can facilitate it. Thank you very much.
Thank you very much, George. That was a great introduction. And I'm very excited to now introduce our cohort who will be speaking in this session. And we will start with Amr from Rology, which is an Egyptian AI-assisted teleradiology platform. Amr, over to you.
Thank you, Eli. Share my screen. Can you see my screen right now?
I think we can't see your screen anymore. We saw it briefly, though. Yes, now we can. Yes, now we can.
So, thank you so much for the opportunity, and actually, thank you so much for the full program and the accelerator. It was an amazing experience with BCG and the Homegrown Solutions accelerator, which is take us through the journey from the beginning. It was a great 6 months overall. So I'm here talking about Rology, and we are in Rology. We are the leading teleradiology platform in the Middle East and Africa, equipped with the AI DICOM viewer as Forbes ranking us as Rology. Rology, which is already founded 5 years ago through a founding team full of experience of all aspects for the healthcare. And our starting from the business, medical, and operation, so on and so forth. So from day one, our main focus is to solve the severe shortage and the misutilization of radiologists, which is facing all over the world, and the numbers overall getting very hard and very tough in Africa overall. So we have some countries in Africa, they have only one radiologist for every 1 million citizens, which is way below the recommended number and the average number as well. So, and this severe shortage of radiologists, which is cause and lead to high latency reporting time, and actually one of the very important point also, there is no accessibility also for the diagnostic reporting overall. So which affect the diagnostic services very badly. And that's why we built Rology, which is an AI-assisted teleradiology that remotely and instantly matches radiologists with cases from different hospitals, different clinic with the optimum radiologist based on availability and subspecialty. And one of the main edges we have in Rology that we do this through a zero setup cost. So any hospital doesn't need any kind of infrastructure to start working with Rology. They can just register through the website in something like 30 minutes, 1 hour maximum. Everything, all of their machines will be integrated on with the platform, and then they can have diagnostic services directly. So because it's and the main thing about the zero setup cost point of view, because we already homegrown solution, and we know the situation for the African hospitals, and we know what our hospitals really need. That's why we didn't require any kind of infrastructure, and we give the availability and the power to the hospital to scale the radiology services and accessibility for the radiologist without any kind of infrastructure. So we promise the hospitals and our clients with 3 main points. We promise them to provide a fast diagnostic report, accurate diagnostic report in a very valuable cost overall. So we have a very competitive turnaround time. We deliver the final diagnostic report in maximum 2 hours for CT, MRIs, and maximum 30 minutes for the X-rays, ultrasound. So, and it's accurate because we have a high qualified radiologist pool. We have right now more than 200 consultant radiologists, which is working 24/7 on the platform. And also, we have a full automated quality control, quality assurance process. And we cut the infrastructure cost for the hospital, so we can reduce the OPEX for the radiology department by at least 25%. We have been in the market for 4 years, almost 5 years still now, and we helped to save more than 500,000 lives overall. We started in Egypt, and right now we are operating in 9 countries with more than 150 clients. We have an office in Egypt and also a local office in Kenya. We also have customers working with us from Malawi, Ghana, DRC, and so one of the very important points is that we have a very healthy economics right now. We have more than $1 million US as AAR, and our profit margins, it's 30%. That's getting increasing, and we have more than 90% client retention rate, which is give us a very good opportunity to scale overall. One of the very important point that we're generating a huge amount of data through our platform. And, right now we have more than 200 million medical images. And this medical images we used to improve our margins through optimize the cost through the intelligence solutions overall. So by building AI solutions for matchmaking, for diagnosis, to help the radiologist to make the job faster and in more productive way. So it gives us to the power to make more margins and to optimize our costs. One of the very important points that we have a very high accuracy, medical accuracy, and this is mainly because of using the AI techniques and AI tools for the quality control. And I think it's mainly about the categorization we are using the AI in. So we use this data mainly for 4 main categories overall. So we use the AI for optimize the operation. So doing the matchmaking in a faster way, doing the to choose who's the optimum radiologist to work on this case, to guarantee a low turnaround time for the scans for the hospital. So this is the first category. The second one, which is boost the radiologist productivity by assisting the radiologist to quickly identify the area of interest in the scan, so he can do the job faster, and this gives us the ability to do better margins. And also we're using the AI assistant tools to annotate some images, which is make the images very valuable for teaching, training, and intelligent diagnosis for our radiologist pool, which is we use it also to train the radiographers in the hospital through our platform. And the fourth categories, which is the auto diagnosis and the auto report tool, and we have some automatic diagnosis for special cases like CT chest and X-ray musculoskeletal and CT brain, which is really have very high accuracy in our platform. So at the end, I want to mention that the teleradiology market and the radiology market is growing very fast in MEA region. We targeting the Middle East and Africa as our first scaling phase. So the total addressable market for the teleradiology is $1.5 billion dollar overall, and it's very very attractive market with a very high because very important point, which is accessibility. The bin is there, and the bin is high actually in the MENA region overall, which is give us a better opportunity to scale overall. So we expect to be in more 5 countries, solid countries. Beside Egypt, we are focusing in Egypt, Kenya, Nigeria, Saudi Arabia as our main markets in the next growing phase, and the other markets, which is more of opportunistic. So thank you, and
thank you so much. It's great to hear about Rology and all that you're achieving and doing. For attendees on the line, please feel free to add any questions you have in the Q&A and chat. We will also have a separate networking session immediately after this, so please do stay on for that. In the interest of time, I would like to call on Mohammed from DataPathology, which is a remote pathological diagnostics platform from Morocco.
Hi, everyone. Do you hear me well?
We do.
Yes, okay. So do you want me to start? Okay, so allow me to share my screen. Okay, can you see my screen?
Yes, we can.
Okay, perfect. So hi everyone, and thank you for being here. So allow me to speak today about a global health issue. Actually, in many parts of the world, and especially in Africa, cancer is very present. Today, we are talking about a cancer pandemic. So the number of cancer cases is very high in the continents. Also, women are the most touched. Mortality and incidence caused by cancer remains high. The problem we are highlighting today is the lack and delay of cancer diagnosis in Africa. So this is related to doctor shortage mainly. We are speaking for doctors about pathologists. So pathologists are the specialized doctors responsible for analyzing human tissues, what we call biopsies, and determining if a cancer exists or not. Also, the second problem is that the delay can go up to 1 month to have a cancer diagnosis today in many parts in Africa. So this is also related to the international shipping delays. As a response to this problem, we took the initiative 2 years ago to create DataPathology. Our goal is to provide the cancer diagnosis to the African patient wherever he is located. So our mission is to build an ecosystem for delivering the cancer diagnosis, or globally what we call the anatomopathological diagnosis, with the help of the digital which makes possible the conversion, the storage, and the transport of a physical biopsy into a digital image. The second axe used is the medical expertise. So we work with a network of experienced professors and doctors in pathology, and also the use of clinically validated intelligence artificial algorithms to leverage the cancer diagnosis, to give more accuracy, more precision, and to do it in a quicker manner. Let me share with you here the global workflow that we have for this tele-expertise that we provide. So actually what I would like to highlight here is that we set up our own laboratories. So we have 2 parts. We have like a local laboratory, a connected laboratory in which we are able to process a biopsy and to convert it into a digitized image. And we have remotely doctors who are working to assess these cases. So in the local, for example, today we are present in Djibouti. So in the local laboratory, a patient goes for a consultation to see a prescriber. The prescriber, if there is a suspicious, something suspicious about cancer, he takes a biopsy and sends it to our local laboratory. So DataPathology receives in its local laboratory a biopsy. The biopsy enters a laboratory process to produce what we call an in vitro slide. So this in vitro slide could be digitized using a slide scanner. This is what we show here. So the slide is like that with this biopsy. Then it is converted to a digitized image. And once it is converted, this image can enter a digital platform to be diagnosed and assessed by a doctor, and also to be checked by an intelligence artificial algorithm. We are integrating clinical validated algorithms. We work with many providers. For the clinical validated algorithms, we have a certification, like a CE, IVD certification, or an FDA certification for the American providers. And in this case, the accuracy reaches 99%. But of course, this is just to help the pathologist, and there is all the time a double check from the pathologist. Once the case is assessed, a medical report is produced remotely and sent back to the prescriber. So this is the global workflow. 2 words about our marketing plan. So we speak about our solution in the professional congresses and the international congresses of pathology and digital pathology, mainly in Africa, Europe, and Middle East. We often also organize with our partners webinars to promote the impact of digital pathology. And we organize for our leads clients presentations and demos depending on their context. So in our revenue model, we have 2 main services: tele-expertise, which means giving a diagnosis for a patient with symptoms, and cancer screening, which means looking for cancer before symptoms appear. Here, the price in average for each act. And also we need a minimum of cases per location per day to be able to open a local laboratory. So this is a study before, of course, going and implementing a laboratory depending on the volume. Also, we can collect by a logistic network biopsies from nearby areas once we are established in a location. Just 2 words about our financial projections. During the next 2 years, our objective is to consolidate our presence in West Africa, in countries like Senegal, Guinea, Côte d'Ivoire, France-speaking countries. We are also targeting a market share of 3% by the end of 2024. So here we can highlight that the need of expansion of digital pathology will remain huge in the continent. We have been in the programs of 2 incubators in 2021. Then we had the opportunity to close a pre-seed fund with South Beach. This allowed us to finance the opening of 2 laboratories, one in Djibouti, and the other one is in progress in Kinshasa, in Congo. Our extension plan for the 2 following years is in some countries, as I said, like Senegal, like Cameroon, and some countries in West of Africa. And as I was saying, we are targeting 7 new laboratories in the 2 following years. So the mission that I am presenting here it's like a first step of a global vision. So our global vision is to use this tele-expertise and screening to be as a first step of the creation of a digital pathology of the first digital pathology ecosystem in Africa. So we have also the will to set up a business-to-business marketplace, and also to anonymize and to use dataset and images for intelligence artificial providers, and also for some pharmaceutical industries which are interested in some pathologies. We would like to develop e-learning in digital pathology with setting up partnerships with universities. And the digital pathology is also a part of omics and precision medicine. So this is with a huge benefits for patients. So the co-founders here, allow me to present the co-founders. So mainly we are working, me and Dr. Hisham El-Attar, who is a professor of pathology. Dr. and Professor Basma Al-Khanoussi, who is also a professor in pathology in Rabat in Morocco. And one of the co-founders is Mr. Mohamed Azizi, who is our Chief Data Officer. Thank you for your attention, and I stay available if you have any questions.
Thank you so much, Mohammed. It was really great to hear about data pathology and the very important work you're doing. Let me now call on Emmanuel from OCLIYA, who is based in Congo and is a local telehealth and home visit platform. Emmanuel, over to you.
Hi, Emmanuel from Malawi, actually.
It is my mistake.
That's right. Okay, so let me share my screen. I can't see my presentation. Why?
Emmanuel, if you give us 1 second, we can pull it up for you as well.
All right.
Please give us 1 moment.
Okay. Okay.
Are you able to see the screen?
Yes, yeah.
Great. Please go ahead.
I was trying to share my video, but unfortunately you can't see me also. Yeah, so my name is Emmanuel Shajina, the founder and CEO of Online Clinic Year 2 from Malawi. In short, we call it OCLIYA. That's the short form for Online Clinic Year 2. So at OCLIYA, we are providing access to remote consultations and home-based care. So next slide. Yeah, so I would like you to meet Anne. Anne works at a bank, and she has a mother who has a fractured hip. So Anne has to balance her work time and also by taking her mother to the clinic. This has created a lot of stress for Anne. So this story of Anna is not uncommon. It's common actually very in Africa as a whole. About 500 million Africans, they do not have access to healthcare. So the problem that we are solving at OCLIYA, it's late access to healthcare due to these three factors: long distance, high medical cost, and insufficient medical personnel. So for example, in Malawi, about 11 million Malawians, they mention distance as the greatest barrier in healthcare. And also, it's a good thing to mention that Malawi next. Yeah, so looking at the health industry in Africa, it's about 151 billion US dollars. But coming back to Malawi, you're looking at about 40 million USD as the local obtainable market for OCLIYA, basically. So the number of people who can access visual healthcare in Malawi is very, very limited. And it's also good to mention that OCLIYA is actually the first and the online telehealth service in Malawi. So OCLIYA is trying to bridge this gap in the market by providing remote consultation and also home-based healthcare. So the solution that we are providing home-based healthcare and also online medical consultations through our online and offline platforms to patients at the comfort of their home. So we have our website, www.ocliya.com, where patients are able to do consultations, are able to book home-based healthcare, and also they're able to find other healthcare practitioners. So we also have a mobile application, which is found on Google Play Store, where patients are also able to do the same, but more convenient. So all these two things, they are matched together with home visits. For conditions which cannot be done only online, we are able to do home visits to them. So this, the website as well as the mobile app brings together the telemedicine and the home visits for our patients. Next. So how do we make money? We make money through subscriptions, fee for service, and commissions. For subscriptions, we have discounted fees for patients who we are staying with them for a long period of time. So for those who have like chronic conditions, we are staying for them for the long time. So they pay a discounted fee, which is a subscription per month. So this one ranges from about $30 to $100 per month. And we also have patients which we see as the one-off payment. So they pay about $15 to $40 per that specific service. So also because as a small team which is growing, obviously, but we have many patients which we cannot manage on our own. So we are able to share those with other practitioners. So by that, we share the revenue, 20% for OCLIYA and 80% for the facility as a referral. So telemedicine, we have been using it also as a value addition in cases of patients who obviously need home-based services. We are able to provide telemedicine as just a value addition. Next. So our financial projections, we are looking at making up to $5 million US by year number 5. Since we are the very first online clinic, we have faced some challenges. So but the revenues that we have been making per year at about $10,000 US, we are projecting to be making up to $5 million US by year number 5. So our jobs, full-time jobs, are looking at about 80 jobs by year number 5. But in terms of part-time jobs, we are looking at more than 500 jobs, because currently we have more than 50 healthcare workers in our database, which we send also to as a third-party therapist. So the jobs that we are looking at, it's up to 500 for those who are part-time, but for the full-time, we're looking up to 100 jobs. So our customers are looking at the growth of about 10% per year. Next. So far we have started in 2018. We started our operations on WhatsApp, and we have been growing actually from the very, very scratch. And now in 2019, we launched our basic website, where it was the first online clinic for Malawians. And there we have grown up to in 2020, where we relaunched our website with improved features. The first one was very basic. And in 2020, we also managed to raise a grant from UNDP. And also, we have also managed to raise some small grants also from a contest and also from as a loan. So far in 2022, we have saved about 10,000 clients. And of those clients, during COVID, most of our clients were not paid. So we, till now, we have about 1,600 paid users. So per year, we are making about 10,000 annual revenue in terms of like in 2022. So in 2023, looking forward, we are looking at raise seed capital of $150,000. We have learned so much from 2018. So we have things which we like to do, things we would like us to get us to the goal of making 5 million USD. And we know that this 150,000 is going to help us, and I'm going to explain it later, how we're going to use it. So OCLIYA falls on the side of being affordable and also being a health tech facility. That has given us a lot of advantage because we're able to provide an affordable pricing while trying to solve our local healthcare challenges. Our competitors are looking at public clinics, we're looking at private clinics, and also one platform in Malawi, which is called Doctoora. This one, but has only main emphasis by taking a medical doctor to a patient's home. So that's how we are differentiated. But in terms of pricing, OCLIYA is also much, much better. So that's the competitive advantage for OCLIYA compared to other facilities. So our team is made up of 6 people full-time, and our members they fall in the category of health, ICT, and also finance. So we have the chief operating officer, we have a technology officer, an accountant, as well as also physical therapists and medical doctors. So that's the composition of our team. Next. So on our ask, as I talked about, we're looking at $150,000, which will help us significantly in terms of the things that we want to achieve. Looking at, as I said, that we are selling in very uncharted waters as the first online clinic. So we like to allocate about 10% to R&D so that we can improve much on our service to provide the kind of value that patients require from an online clinic. And we're also looking at investing some of the money, 20%, into marketing so that most people can know. Because even today, since we started in 2018, today we still have people who say, this is my first time hearing about OCLIYA. But you can see it's already 4 years down the line. So we'd like to spend also significant sum in marketing. And also a mobile home-based service, since we have it as also part of our main offerings to our patients, we're looking at about 25% in a home-based service and 30% to increase and improve our software and online platforms. So reaching this far, this has been Emmanuel Chatina, founder and CEO of Online Clinic Year 2, and I'll be happy to take if there are any questions. Thank you.
Thank you, Emmanuel. It's really wonderful to hear the impact you're having in Malawi. Please, attendees, do add any questions into the Q&A section, and you'll have more time to speak directly with Emmanuel in the networking after this. And with that, let me call our final presenter for this session, Abdul Samad, who is representing Doctors on Call from Sudan, which is a platform allowing doctor home visits.
My name is Abdul Samad Doka. I am the CEO and one of the co-founders of Doctor on Call, short for DOC. It's Sudan's first digital healthcare platform that treats its patients on site. So essentially what we do at DOC is we communicate with our patients through online and digital means, and then provide medical personnel to reach their location and treat them in the comfort of their homes or in their offices. And we're currently operating out of the capital of Sudan, Khartoum. Next slide, please. My beloved country, Sudan, is a country or a state in crisis. With the lack of government and a deteriorating economic situation, this has put strain on an already under-resourced and overwhelmed healthcare system. This has affected the availability of healthcare services and affected the cost of delivering these services. Doctors are migrating and flocking out of the country as well, further exacerbating the situation. General practitioners' visit right now in public settings have reached $14 USD, and in private settings up to 30 USD, in a country where the average standard of living is about $6 per day. The issues that we're tackling at Doctor on Call involve helping our patients with their health navigation and essentially helping them make an informed decision so as to where to get treated and how to best get treated. Another issue we're tackling is the conventional or hospital or doctor visit. So this environment has led the experience of going to the doctor and getting treatments to be a very unpleasant experience, together with the risk of perhaps acquiring an infection. And then we have the mobility challenges. Getting around can be difficult. The lack of a dependable transportation means, security issues with the demonstrations in the street, in addition to the more common causes of mobility difficulties such as obesity, elderly patients, dependent patients, and so on. Next slide, please. We at DOC have solved these issues by coupling digital and online solutions together with the convenience of on-site healthcare to tackle the issues of health navigation, mobility, and disrupting the conventional or traditional doctor visit. In the process, we have managed to empower hundreds of doctors, nurses, technicians by providing alternative income and a great ecosystem for operating on-site and in the medical field. Next slide, please. The scope of our medical services at DOC is on-site healthcare services, workplace on-site services, and telemedicine. And this comes across a wide range of medical specialties, which makes the service special. And part of this is due to the fact that the existing healthcare system is semi-broken. So more and more people are readily becoming ready to accept different specialties to be given to them at home, whether laboratory, radiology, ECD, physiotherapy, psychiatric, dental, these services mentioned in front of you, in addition to other services that we're introducing, such as eye care. All of these services are being delivered at home or on-site. Next slide, please. These services have generated revenue for DOC. Some of this revenue we share with our doctors, nurses, and some of our partners in the sector, such as lab and pharmaceuticals. We are also looking to explore new revenue streams in the form of registration fees for our medical personnel. Next slide, please. The service DOC is targeted at 4 million patients in Khartoum. As I've mentioned, we are operating out of the capital of Sudan, Khartoum currently, and we're targeting 4 million people or 4 million patients in the capital. We're also looking to onboard 30% out of 2,000 organizations based here in Khartoum. This is part of a new service called our corporate service, a subscription-based service that aims to enhance the sustainability of the business. With our great career guidance, continuous medical education, and empowerment of medical personnel, we're aiming to also target this group by onboarding 50% of the doctors here based in Khartoum to the service. Next slide, please. With regards to our projections, we hope that we will be able to grow our revenues 15% each year. We are looking to achieve that by introducing new and great services like our corporate service, which is based on subscriptions, and smart packaging and selling of the services that we provide in the form of family packages and chronic illness packages. We are aiming to achieve this by targeting the 4 million people in Khartoum, like I mentioned, acquiring 1% of the market in the first year, which we have done, and growing this by 10% yearly. We're aiming to serve over 700,000 customers by 2027 and onboarding more than 700 medical personnel into our database by year 5. Next slide, please. Yeah, our journey was great. 2019, we finished app development and we set up our operations. 2020, we officially launched. It was a very exciting period. And we onboarded more than 150 doctors and medical personnel. That was done very quickly because of the COVID-19 pandemic. A lot of doctors wanted to help. A lot of families needed help. And we've managed to land over 10,000 downloads of our smartphone application on the Google Play Store. 2021, we started serving over 8,000 customers, 300 of these being COVID COVID-19 patients with positive outcomes. This year, the service's total generated revenues exceeded more than $150,000, and we have launched our corporate package. Next year, we're aiming to secure our seed capital and start scaling up operations in the capital here, Khartoum, hopefully. Next slide, please. Yeah, so we're not alone in this space. Other solutions do exist. However, Doctor On Call stands out by providing online and offline solutions together with a vast array of medical specialties, all delivered in the comfort of your home. So if you compare this with developed countries, the services that are served on site tend to be rotating around geriatric care and palliation. However, with the disrupted or the burdened or overwhelmed healthcare system in Sudan, more and more people are, as I've mentioned before, starting to accept different kinds of specialties being delivered at home. Of course, we're doing this safely as possible. So we stand out by providing online and offline solutions, like I've mentioned, together with a wide array of specialties, in addition to partnering with Great Hospital in Khartoum. And this provides an integrated and great ecosystem with a good backbone to treat patients in the home if needed. Next slide, please. I forgot to mention that the previous slide, all of us are in the same ship with regards to suffering the burden of the rising cost of logistics here in Sudan. The people behind this great effort are the people in front of you. I'm going to start by mentioning Dr. Hashim Suleiman, our medical director. He's one of the co-founders, by the way, and he's of course helping us make sure that our patients are getting well and our medical personnel are following protocol, in addition to other key responsibilities. Mrs. Ra Faisal Ali Hamad, she's the corporate manager, engaging with our corporate pipeline and making sure that all of their needs are met. So we're trying to become a more gender inclusive company, and Mrs. Ra is bringing that element to the core team. She's a great person. Dr. Mohammed Abdel Qadir is the head of operations and director. Without him, nothing would function properly. He's responsible for logistics, operations, and of course, the IT component. Next slide, please. Yeah, we're asking for $250 US. Of course, a significant amount of this will be used to scale up the operations here in Khartoum. In addition to that, part of this will be used to acquire new assets in the form of ambulances, shuttles, motorcycles to get our medical personnel around together with medications and consumables. And part of it will be spent in promotion and development of our digital platform. We truly believe that the future of healthcare will involve the use of digital technologies and digital platforms like Doc for patients to acquire healthcare and for health navigation, and by governments and corporations to help spread the reach or the coverage of primary healthcare. Thank you very much for your time.
Thank you so much, Abdul Samad. That was great to hear.